In Calderdale and Huddersfield, we need to make changes to our urgent and emergency care services. We currently have an accident and emergency service at each hospital. Neither site is meeting national standards and guidance for emergency care. They're understaffed, struggling to recruit doctors and specialist nurses, relying on temporary or junior staff, and they struggle with the overall number of patients. Our planned care services can be interrupted by the need to divert staff, equipment and beds for emergency care, leading to cancelled or delayed operations for patients. We don't have a dedicated specialist children and young people's emergency centre. This situation isn't safe, and we need to think radically about making changes to our services and what they would mean for you. Our dedicated specialist units work very well to deliver the best care and treatment. You already go to Leeds for heart attacks, Wakefield for serious burns, Huddersfield for major fractures, Calderdale for strokes. We want to adopt the same approach in getting the very best emergency care and the very best urgent care. There are a number of proposed changes. A centralised emergency centre in Calderdale would serve everyone, have full teams of consultants and specialist staff who would deliver the latest specialised care for patients with potentially life-threatening conditions 24 hours a day. When we have the right people in the right place at the right time, we can save more lives and improve outcomes for all patients who need emergency care. A brand new dedicated specialist children and young people's emergency centre based in Calderdale would bring together medical and surgery services for children and young people across Calderdale and Huddersfield for the first time. There would be 2 dedicated urgent care centres. These would be in an improved Calderdale Royal Hospital site and a brand new hospital on the Huddersfield site. The 2 urgent care centres would be for urgent and non-life-threatening conditions, fully staffed, meeting national standards, with a medically led 24 hours a day service supported by teams specialised in urgent care. These centres would provide most of the care that people go to A&E for at the moment. We expect over 50% of people who currently go to A&E themselves would have their needs better met in the new urgent care centres. Both centres would treat conditions such as sprains and simple fractures, minor illness and chest infections, cuts that need dressing and suturing, minor burns, removal of foreign bodies from eyes, and urine infections. There would be access to blood tests, X-rays and other tests, and a wide range of technology. If more specialist emergency care is required, you would be transferred to the dedicated emergency centre. This is building on a model of care that NHS England has been developing over the past 2 to 3 years. What this would mean for you. You would ring 999 for potentially life-threatening conditions and 111 when you're not sure. This means you'd be directed to the right place first time. Rapid access to senior medical staff for those with life-threatening illness improves outcomes. This is why the proposed change is for one emergency centre site dedicated entirely to this kind of need. You would get access to the new emergency centre via 999, 111, your GP or a referral from the urgent care centre. And for everyone else, if you have an urgent condition, you can phone 111 who would book an appointment for you at the urgent care centre. Some people have asked us if we're losing services to save money. We will not be losing services. We'll be reorganising them so that they work better for local people and create safer, high-quality services which will save lives.